Hey, I'm James Sherer. I'm a board certified psychiatrist and addiction psychiatrist, and I am currently the medical director of addiction psychiatry at Overlook Medical Center in the Atlantic Health System in northern New Jersey. Tech addiction is use of technology that is causing some form of functional impairment or distress. And it can't be something that happened yesterday or last month. Usually, we say to really have an addiction to something, someone has to be struggling with it for about a year. And over the course of that year, it has to become clear that their use of the thing is leading them to feel more depressed, more isolated. It's making it more difficult for them to fulfill their roles at work, at home. It's leading to an excess amount of time spent using the technology. It's leading to more difficulty turning away from the technology and even emotional withdrawal symptoms when someone is forced to. So there's a lot of these kind of associated symptoms that go along with a technological addiction, but the real heart of any addiction, but certainly one to any piece of technology, such as social media or video games, is a pattern of behavior for at least a year that's leading to impairment or distress. Yes, there are definitely different types of tech addiction. We used to think that maybe all technology addiction to social media, video games, online gambling, were maybe different branches of the same core problem. But now we realize, as all of these things have changed and evolved, social media today looks very different than it looked 5 years ago. And I'm sure 5 years from now will be, something that we can't even recognize. It's becoming clear that these really are separate addictions. The things that make online gambling, online sports betting addictive are very close to the things that make gambling in general addictive. The things that make social media addictive tap more into the fear of missing out and similar anxieties. The things that make video games addictive, very much more closely resemble something closer to online gambling, so on and so forth. So no, we definitely think that these are separate entities. So the signs of tech addiction are going to vary based on what technology we're talking about. For example, if we're talking about social media addiction, we're talking about using the application more and more. We're talking about having a tremendous amount of anxiety and angst if your access to that app is restricted in any way. We're talking about using that app when you should be paying attention in school or when you should be paying attention at work. We're talking about lying to your family about the use of the app, so on and so forth. It's very much focused on the specific uh, technology itself. Now, some of those things will be conserved across, different addictions. Um, but not always. And the other thing that complicates this question a little bit is that we as psychiatrists are still in the process of clearly defining these things. There are only two behavioral addictions that can be found in the fifth edition of the Diagnostic and Statistical Manual. One is gambling disorder. That's really the most clearly defined one, and that's in the main body of the DSM. And then there's internet gaming disorder, but that's actually in the back. It's in an appendix and it's listed as requiring further study. What you won't find in the DSM yet is something like social media use disorder or social media addiction. For that, we rely on a lot of screening tools and scales, such as the Bergen Social Media Scale. But those are screening for very specific things about social media and aren't necessarily designed to be an all-encompassing definition of what social media addiction might be. I say all that to say that it's early days. We're learning more and more. There are some things that are similar across different technology addictions, but for the most part, since we really are focused on the particular app or technology itself, of course, there's going to be significant differences as well. So tech addiction is treated in a variety of ways. Um, I will say that a lot of the studies that I've looked at what are the most effective treatments for different tech addictions are very early, and clearly more research is needed. But we do know even now that first and foremost, like many things in psychiatry, certain types of talk therapies like cognitive behavioral therapy can be quite efficient and effective to treat different tech addictions. Something like motivational interviewing, which is more of a conversational style rather than a specific talk therapy modality, can also be used and can help something like cognitive behavioral therapy or CBT be very effective. And then, of course, there are medications that we've looked at that can be quite effective, just depending on which specific tech addiction we're looking at. For example, for internet gaming disorder, which is video game addiction, depending on the patient, it might make sense to introduce something like an antidepressant, perhaps something like Lexapro or Wellbutrin, and it might even make sense to introduce something like a stimulant like Adderall or Concerta. But if we change gears just a little bit and we think about maybe online gambling and online gambling apps, sports betting apps, which in a lot of ways share a lot in common with some video games, the recommended treatments start to vary somewhat. You still certainly can use antidepressants. Um, Older ones like tricyclic antidepressants can be effective. And there are some other treatments above and beyond what I just discussed for video game addiction that can be effective as well, including mood stabilizers like Depakote, things like N-acetylcysteine, and then, of course, naltrexone can be very effective, both for online gambling and internet gaming disorder as well. When it comes to social media, that's really a question of talk therapy like CBT, but also identifying and treating any underlying issues. If there's any depression that was already there or anxiety that was already there, that perhaps the patient is using social media to self-treat, maybe in a maladaptive way. Certainly, identifying those issues and targeting them with a combination of talk therapy and medication can be very effective. So long story short, it depends on which technology we're talking about. The answer is typically some form of cognitive behavioral therapy and some form of medication. The good news is that early studies do show that these types of interventions can be pretty effective, but we definitely need more, bigger, better studies to know for certain which would be the absolute best routes to go with which medications and which therapy. This is a very difficult question, and it's one I deal with all the time, both in my day job and also in my private practice. I think the first thing to do is be non-judgmental and curious about your child's use of any technology. You should really be wondering why they're using that technology. What is the draw? Is the draw something social? Are they using the game or the social media application because all of their friends are? If that's the case, you have to tread lightly if you're talking about rescinding their access to that thing, because you're also going to be rescinding their access to their social circle to a certain extent. So be curious, ask your child, what is that game? What is that social media app? If it's a game, offer to play with them. If it's a social media app, offer to make an account yourself and, see if you can interact with your child that way. Approach it first with a sense of curiousness and, open-mindedness. And then if it becomes clear to you that the use of that technology is leading again to that level of clinical functional impairment that we talked about earlier, maybe your child's grades are falling, maybe they're giving up activities that they used to enjoy, they used to love playing soccer, but now they're just glued to the TV playing video games, or if there are other warning signs that you notice, that's when it's time to start taking action. First and foremost, a very effective way to do that can be to use parental controls. Most cell phones have some way that a parent can exert a level of control over a child's phone, either restricting which apps are available or how much time the child can spend on said app. You can even, if you wanted to not go that far, you could even just take a look at the usage statistics on the phone to see exactly how much time your child is spending on the application. And that can help you kind of come to a determination whether use of that app is healthy or not. I will say this here, there is no magic number in terms of hours used, at which point a child becomes addicted to a certain game or social media platform. It might sound like a lot for a child to spend 2 or 3 hours a night playing Roblox, but if that child is also getting good grades, participating in sports, behaving well at home and at school, maybe that isn't an issue that you need to intervene on. But for other kids, 2 or 3 hours of Roblox a night might mean that their grades are falling, that they are giving up sports that they used to enjoy, that they're becoming moodier both at school and at home. And that's when you really start to wonder if there's an issue. At that point, you can definitely, seek out help from a mental health professional. You can find them at psychiatry.org. You can find them through your insurer's website. You can find them through Psychology Today. There are certainly plenty of therapists and psychiatrists out there who specialize not only in child psychiatry, but also these types of new addictions and can help lead you in the direction of whether perhaps just good old-fashioned talk therapy can help that child reduce their use of the app, or maybe even a medication, especially if there's another underlying psychiatric issue at play. So long answer, difficult topic and situation, one that I think the vast majority of parents are wrangling with right now. My heart goes out to them, and just know that help is out there. We're learning more and more about this stuff every day. And, we really can, get this under control, even if you really find that your child's use of an application is really leading to a significant amount of dysfunction.